Hi, my name is Dr. Rilwan Adan, and I would like to discuss with you about the thyroid gland. So, what is the thyroid gland? It is a small butterfly shaped gland in front of the neck. Despite its size, it behaves like a master switch, quietly controlling metabolism, energy, heart rate, body temperature, and many essential body functions. A thyroid nodule is simply a lump within this gland, and this is where context really matters. If we rely on our hands to examine the neck, palpable thyroid nodules are found in about 5% of women and 1% of men, those living in iodine sufficient parts of the world. But the moment we use high resolution ultrasound, the picture changes completely. Ultrasound studies show thyroid nodules in 20 to nearly 70% of people, especially women and older adults. So suddenly, nodules go from being rare and frightening to something incredibly common, almost like finding gray hair as we age. This is why discovering a thyroid nodule is usually not the real problem. The real clinical importance of thyroid nodules comes down to one question: could this be cancer? And here is the reassuring answer. Only about 7 to 15% of thyroid nodules turn out to be malignant. And this depends on age, sex, radiation exposure, and family history. So, our job as clinicians is not to panic. It is to identify the small minority that need attention and safely reassure everyone else. Does a thyroid nodule mean cancer? This is the biggest myth to clear up. A thyroid nodule does not automatically mean cancer. In fact, 90 to 95% of thyroid nodules are benign, and this is according to the American Thyroid Association and British Thyroid Association. Doctors don't make decisions based on size alone. We look for patterns, much like a detective looking for clues rather than jumping to conclusions. A large nodule can be completely harmless, and occasionally a small nodule raises suspicion. Context always matters more than fear. How do doctors investigate thyroid nodules? There is a clear stepwise approach. This is not guesswork. First, we check your blood, do a test called TSH, that is thyroid stimulating hormone, to understand how the thyroid is functioning. Second, and this is the most important step, we use ultrasound. Ultrasound tells us far more than just the size. It shows the shape, the borders, the texture, and internal features, almost like switching from a blurry photo to high definition. Here is a key point many patients don't realize. In general, only nodules larger than 1 centimeter are evaluated further because these are the ones with a meaningful chance of being clinically significant. Smaller nodules, like those under 1 centimeter, are incredibly common. Most are innocent bystanders and never cause harm. That said, there are exceptions. If a small nodule is causing symptoms, has suspicious ultrasound features, or is associated with enlarged lymph nodes in the neck, then it absolutely deserves closer attention, regardless of the size. Very rarely, a tiny nodule without warning signs can still matter. This is exceptionally uncommon. Trying to find and treat every tiny thyroid cancer, just in case, actually cause more harm than good through unnecessary biopsies, surgery, anxiety, and lifelong medication. So, the guiding principle in thyroid care is this: most thyroid nodules are low risk, and many thyroid cancers are slow growing and minimally threatening to long term health. Some nodules do need further clarification, and this is where fine needle aspiration cytology comes in, abbreviated as FNAC. FNAC is a simple outpatient test. A very thin needle, similar to the one used for blood test, is inserted into the nodule, usually under ultrasound guidance. A few cells are collected and examined under a microscope. There are no cuts, no stitches, and no general anesthesia. Most patients describe it as uncomfortable rather than painful, and it is over in minutes. I often tell patients to think of FNAC as asking the cells directly what their intentions are. When should you actually worry? This is the questions patients really want answered. When should I worry? Most nodules behave like polite house guests. They sit quietly and cause no trouble. But a few show warning signs, and these are what we call red flag signs. Rapid growth is one. Nodules usually change slowly over the years. Growth over weeks or months need an urgent review. A change in voice, especially persistent hoarseness, matters because the voice nerve runs next to the thyroid gland, like a cable beside a road. Difficulty swallowing or breathing can happen if a nodule presses on nearby structures. This doesn't always mean cancer, but it does mean it needs assessment. We also worry about nodules that feel hard, irregular, or fixed, unlike benign nodules which usually move when you swallow. An enlarged lymph node in the neck, especially if firm and painless, deserves attention. Red flags don't mean cancer, they mean don't ignore this. If it is thyroid cancer, what then? The most common thyroid cancer is papillary thyroid cancer, and this is where statistics are actually comforting. The 10-year survival rate exceeds 95%, and in low risk patients, it approaches 98 to 99%. This is from the SEER database, the American Thyroid Association. This cancer usually grows slowly, more like a tortoise than a tiger. Many patients need surgery alone. Some only need half of the thyroid removed. Others may need radioactive iodine depending on risk. Modern thyroid cancer care is about precision and not aggression. Patients often ask, will my life ever be normal again? The answer is yes. If part or all of the thyroid is removed, many patients take levothyroxine, which simply replaces what the thyroid would have produced. It's taken once daily. When the dose is right, people feel normal. Studies show quality of life is preserved in the vast majority of patients, according to the American Thyroid Association. Monitoring is most important in the first year. Over time, follow ups become less frequent. People work, exercise, travel, have children, and live full lives. A thyroid condition is a chapter, not the whole story. If you remember just three things: This is it. 1. Most thyroid nodules are benign. 2. Most thyroid cancers are highly treatable. And 3. Careful assessment prevents unnecessary surgery and anxiety. In thyroid care, doing less is often doing better. If you've been diagnosed with a thyroid nodule, ask how it was assessed. Ultrasound features, blood tests, and biopsy results matter far more than fear. Social media thrives on panic. Medicine thrives on evidence. Knowing when to worry and when not to is what turns fear into confidence. And that is exactly what good thyroid care is meant to do. Thank you for watching.